Okay, good afternoon, everyone. So today we will first hear from Dr. Tam and Dr. New, and then we will turn to Minister Bibeau and Minister Schultz. Dr. Tam?
Good afternoon and bonjour à toutes et à tous. I'll just begin with our usual update on the number of COVID-19 cases in Canada. There are now 24,804 cases, including 734 deaths. I've noted previously that a significant proportion of these deaths are linked to outbreaks in long-term care facilities. Sadly, because COVID-19 can have a prolonged course, these deaths will continue to increase even as the epidemic growth rate slows down. For the lab testing, we've completed tests for over 428,000 people, with now over 5.7% confirmed positive, as Canada continues to improve testing to track where the disease is spreading. To save lives, families, communities, and businesses across Canada have shifted their behaviours to help break the chains of transmission of COVID-19. Though this challenge is nowhere near over, and we will have to work just as hard to get all the way down to a new normal when we reach low levels of transmission. How soon we get there and what that new normal will look like will depend on our actions right now. We know that physical distancing works to reduce the number of people who get infected, and once low enough, the epidemic will run out of fuel. One thing is certain, if we want a best case scenario, we need to give it our best efforts. We cannot prevent every death, but we must prevent every death we can. We need to protect our seniors. So stay home and save lives, and let's give our best effort to plank the curve. Then crush it. Thank you.
Bonjour. On commence tout d'abord par faire le point sur le nombre de cas de COVID-19 au Canada. On compte aujourd'hui 24 804 cas de COVID-19 au pays, dont 734 décès. On a constaté auparavant qu'un pourcentage important de ces décès est lié aux éclosions dans les installations de soins de longue durée de plusieurs provinces. Malheureusement, puisque le cours de la COVID-19 peut-être de longue durée, le nombre de ces décès continuera à augmenter même si le taux de croissance de l'épidémie ralentit. Nous avons effectué des tests de dépistage sur plus de 428 000 personnes, dont plus de 5% ont été déclarés positifs à la COVID-19. Le Canada continue d'améliorer les tests pour mieux suivre la propagation de la maladie. Partout au Canada, des familles, des collectivités et des entreprises ont changé leurs habitudes pour briser les champs de transmission de la COVID-19. Nous resterons aux prises avec cette pandémie pendant un certain temps. Mais lorsque la transmission aura ralenti, nous ne pourrons pas baisser les bras et devrons nous habituer à une nouvelle normalité. On ne sait pas combien de temps nous prendrons pour y arriver, ni de quoi sera faite la nouvelle réalité, mais nous savons que l'avenir dépend du choix que nous faisons aujourd'hui. Nous savons aussi que l'éloignement physique permet de réduire le nombre d'infections et que l'épidémie s'épuisera lorsque les infections auront considérablement diminué. Une chose est sûre, notre avenir est entre nos mains et nous devons tout faire pour mettre toutes les chances de notre côté. Nous ne pouvons prévenir chacun des décès, mais nous devons prévenir tous les décès que nous pouvons. Il faut absolument protéger nos aînés. Alors, restons chez nous pour sauver des vies et acharnons-nous à aplatir la courbe le plus rapidement possible. Je vous remercie.
Merci, Dr. New. On va maintenant entendre la ministre Bibeau.
Thank you, Dr. New. We'll now go to Minister Bibeau.
Bonjour à tous. Alors aujourd'hui, je suis heureuse de vous annoncer 50 millions de dollars pour aider nos producteurs et nos productrices agricoles ainsi que les transformateurs alimentaires à mettre en place les mesures nécessaires au respect du protocole d'isolement obligatoire de 14 jours pour tous les travailleurs étrangers temporaires. I'm happy to announce $50 million to help farmers, food and seafood processing employers put in place the measures necessary to follow the mandatory 14-day isolation period required of all workers arriving from abroad. Let me tell you why and how our government is taking one more step to help our farmers and food processors continue their vital work of feeding the nation, while protecting the health and safety of Canadians. Les femmes et les hommes qui travaillent au sein de notre chaîne d'approvisionnement alimentaire font un travail essentiel pour s'assurer que nous ayons accès à des aliments de qualité, variés et à prix abordables. Avant la pandémie, le secteur faisait déjà face à une sérieuse pénurie de main-d'œuvre. Chaque année, malgré que le secteur agricole accueille plus ou moins 60 000 travailleurs étrangers, environ 15 000 postes demeuraient vacants.
Some
Cette année, le
15,000
nombre
remain
sera encore plus
unfilled,
grand.
and this year the numbers
Dans
will be
plusieurs
even
régions au
higher.
Canada,
In some
la
regions of
production d'aliments
Canada,
frais, surtout
the
de fruits et de
production
légumes,
of fruits
dépend
and
en grande
vegetables
partie de la contribution de travailleurs étrangers temporaires
on
expérimentés,
the
et ce,
contribution
de la
of
saison des semences ou
experienced
des
foreign temporary
plantations
workers.
jusqu'aux récoltes.
Right up and
Les usines de
harvest time.
transformation de poissons, de fruits de
work
mer, de
in
viande comptent elles
processing
aussi sur un bon
facilities as
nombre de
well for
travailleurs
fish
étrangers
and
pour
meats.
remplir les tablettes de nos épiceries.
And they help
The
to fill
men
our store
and women
shelves.
who work in our food supply chain are essential to ensuring Canadians have access to a variety of high-quality food at a reasonable price. In many regions in the country, the production of food, particularly fresh fruits and vegetables, relies on the contribution of experienced temporary foreign workers, right from planting season to harvest. We count on them to fill our shelves. The same goes for fish, seafood, and meat processing plants. This is why we granted an exemption for temporary foreign workers, along with other foreigners with work and student visas from traveling to Canada. But like all foreign nationals arriving to Canada during the COVID-19 crisis, they must follow a strict mandatory 14-day isolation period. Évidemment, comme tous les Canadiens qui reviennent de l'étranger, ces travailleurs doivent se conformer à une période d'isolement obligatoire stricte de 14 jours. Pour avoir discuté avec plusieurs employeurs, je peux vous assurer qu'ils prennent cette obligation très au sérieux et qu'ils ont à cœur de protéger la santé de leur communauté et de leurs travailleurs. Inévitablement, cette période d'isolement payée mais non travaillée va engendrer des coûts additionnels importants pour les employeurs, notamment pour offrir des lieux de résidence qui permettent le respect des règles imposées par la santé publique. Pour aider les producteurs et les productrices agricoles ainsi que les transformateurs alimentaires à assumer ces dépenses extraordinaires, le gouvernement fédéral leur accorde un montant forfaitaire de 1 500 $ par travailleur étranger temporaire. We recognize that meeting these isolation rules come with a cost for businesses. That is why today I'm pleased to announce that the new federal support provides employers with $1,500 per worker to help put in place the measures necessary to comply with the strict public health requirements. This exceptional program will be available as long as the Quarantine Act is enforced and the isolation protocol has to be followed. Government authorities will follow up regularly, and employers or workers who do not comply will face severe sanctions and fines. At the same time, there continues to be thousands of jobs available in our food sector. Cet investissement de 50 millions de dollars s'ajoute aux gestes que nous avons posés pour assurer la sécurité alimentaire au pays. 100 millions de dollars pour améliorer l'accès à des aliments sains pour les Canadiens les plus vulnérables. Possibilité d'obtenir un prêt de 40 000 $ sans intérêt avec la possibilité de 10 000 $ et que 10 000 $ soit non remboursable. Extending loan deadlines under the advance payment program to help farmers manage cash flow. Allowing all businesses to defer income taxes, GST, and customs duties, and giving $5 billion in additional lending capacity to Farm Credit Canada to help producers, agribusinesses, and food processors remain financially strong during this difficult time. I'm very proud of the strong and resilient food system we have in Canada. Step by step, we are giving our farmers and food processors the tool they need to continue their vital work. We will be there to support them throughout this difficult period. En terminant, je veux remercier encore une fois les producteurs et les productrices agricoles, ceux qui travaillent dans les usines de transformation alimentaire, les camionneurs, les inspecteurs, les épiciers, les bénévoles dans les banques alimentaires et tous ceux et celles qui contribuent à nous offrir des aliments de qualité, diversifiés et abordables. Merci.
Thank you.
Thank you, Minister. We will now hear from Minister Schultz.
Good afternoon, Salud, and thank you very much for joining us today. This pandemic has presented everyone with challenges. However, the most critical is slowing the spread and saving lives. As we know, this is most important for seniors and those with pre-existing medical conditions, as they are at the greatest risk of severe health complications due to COVID-19. Unfortunately, we have seen many long-term care homes in Canada experiencing outbreaks of COVID-19, with some facilities reporting multiple deaths. This is heartbreaking. Residents of long-term care homes are vulnerable to infections due to their communal living spaces, shared healthcare providers, exposure to external visitors, and transfers from other healthcare facilities. The Government of Canada has released evidence-informed guidelines to help residents, seniors, and healthcare workers in long-term care reduce the spread of the virus. Remain safe and healthy. Officials at the Public Health Agency of Canada developed these guidelines in close consultation with their provincial and territorial partners. La ligne directrice aidera les résidents et les travailleurs et demeurer
This work builds on previous guidance in Canada
en sécurité.
and is informed on lessons learned
Work
by other
builds
countries.
on previous guidance in Canada and is informed by lessons learned in other countries, as well as interim guidance from other Canadian and international bodies. Long-term care homes are under the provincial and territorial jurisdiction. However, the guidance provides recommendations that complement provincial and territorial efforts to monitor, prevent, and control healthcare-associated infections. These guidelines may be adapted to other settings, such as retirement homes and residential homes for those with developmental disabilities. The key recommendations include measures such as restricting visitors and volunteers to only those deemed essential for basic medical or compassionate resident care, screenings before every staff shift or essential visitor entry and daily for residents, ensuring staff do not report to work with symptoms, and if they develop symptoms at work, are tested and excluded from work, requiring staff, essential volunteers, and visitors wear a mask during the duration of their shift or visit, providing training on infection control measures, such as proper hand hygiene and use of personal protective equipment, routine additional cleaning, especially for high-touch, high-risk surfaces. Wherever possible, limiting work for employees to a single facility, and limiting the number of locations in the facility in which employees work. And like all Canadians, practicing physical distancing to the greatest extent possible, including during mealtimes. That includes canceling non-essential outings. Many facilities have already implemented several of these measures, and for those, I applaud them for their vigilance and efforts to protect the most vulnerable among us. Providing consistent guidance for long-term care homes across the country will help save lives. And that's by protecting those seniors and those dedicated to caring for them. Assurer une guidance constante auprès des établissements de soins de longue
Providing consistent guidance for long-term care homes across the country will save lives.
However, it will take much more than these guidelines to keep our seniors and vulnerable Canadians safe. It would not be possible to keep them safe without individual Canadians practicing social distancing. We recognize that involves difficult decisions and personal sacrifices. It is essential that individuals practice social distancing to keep everyone safe. I want to acknowledge the role that Canadians all across the country are playing in flattening the curve and helping us all get through this. Most of all, I want to recognize all the caregivers and outstanding public health workers who are doing an exceptional job of providing essential service and who are working tirelessly in our communities in very difficult circumstances. We all need to do our part to help stop the spread of the virus among the residents of long-term care homes, as well as the workers who care for them. Together, we'll get through this. Thank you.
Thank you, Minister. We will now start taking questions, starting with 3 questions on the phone before turning back to the room. 1 question, 1 follow-up, une question et un suivi. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, appuyez sur l'étoile 1 sur votre téléphone clavier. The first question is from Raymond Filion, TVA. Please go ahead. Votre ligne est ouverte.
Oui, bon matin. Une question pour Mme Bibeau.
Good afternoon. A question for
si vous pouvez
Bibeau.
préciser à qui est versé le 1 500 $, à qui ça s'en va et à quoi exactement ça peut servir cet argent-là? Est-ce que c'est pour défrayer les frais d'hébergement?
Is it for accommodations? If you could clarify that, please.
Donc, on va verser 1 500 $. C'est un montant forfaitaire qui va être versé aux employeurs, donc aux producteurs agricoles ou aux entrepreneurs là, des usines de transformation. Ils vont pouvoir utiliser le montant soit pour faire des aménagements dans leur résidence actuelle, soit pour louer des chambres d'hôtel, des résidences étudiantes ou un autre lieu qui serait plus approprié pour respecter le protocole d'isolement, ou encore pour absorber une partie du salaire, puisque les travailleurs doivent être payés pendant 2 semaines alors qu'ils ne peuvent pas travailler.
Est-ce que vous pouvez nous dire si tous les travailleurs temporaires étrangers sont systématiquement testés pour la COVID-19 à leur arrivée au Canada? M. Blanchet du Bloc disait au cours de la fin de semaine qu'un groupe de 159 travailleurs mexicains était arrivé sans avoir été testés, sans avoir été mis en quarantaine. Pouvez-vous également nous dire ce qui est arrivé avec ce groupe-là?
Alors, pour tous les groupes qui arrivent du Mexique, du Guatemala et éventuellement d'autres pays, on vérifie leurs symptômes avant l'embarquement dans l'avion. On leur explique correctement aussi toutes les mesures relatives à leur santé, mais aussi toutes les règles qu'ils ont à suivre lorsqu'ils arrivent au Canada au niveau du protocole d'isolement. On s'assure qu'ils n'ont aucun symptôme avant d'embarquer dans l'avion. Ils vont porter un masque pendant tout le transport. Arrivés à Montréal, évidemment, ils sont accueillis par les services frontaliers, mais aussi par différentes organisations de l'industrie agricole qui sont très expérimentées dans l'accueil des travailleurs étrangers. Donc, ils vont encore avoir à cette étape-là d'autres informations qui vont leur être transmises. On va les mettre à bord d'autobus nolisés, privés, qui vont aller jusqu'à la destination, là où ils vont devoir passer leurs 14 jours d'isolement, donc sur la ferme, à l'hôtel, dépendant de chacune des situations. Alors, à partir de là, c'est la responsabilité de l'employeur de s'assurer que le travailleur a toutes les bonnes informations, a un lieu adéquat pour passer son 14 jours d'isolement, qui va être nourri correctement, qui a accès à tous les produits sanitaires, sa propre hygiène pour entretenir son lieu de résidence aussi. Et dans le cas du Québec, il va aussi avoir un suivi de la santé publique du Québec dans les différentes provinces aussi pour s'assurer, surveiller les symptômes au fur et à mesure au courant de ces 2 semaines d'isolement.
Merci, Madame la Ministre. Opérateur, prochaine question, s'il vous plaît.
Thank you. Merci. The next question is from Mia Rabson from the Canadian Press. Please go ahead. Your line is now open. Votre ligne est ouverte.
Hi, this is a question for Dr. Tam. 2 weeks ago, you said a few times that the coming week or two was crucial in your how things were going to play out and for your own understanding of what was happening. Can you explain what specifically you've learned in the last 2 weeks and what sort of crucial information is now informing the current decisions and responses that we have?
Yes, so part of the crucial observations and from a public health domain is, of course, still the ongoing challenges of long-term care facility outbreaks, which is why I think all the chief medical officers, all the provinces and territories are trying to do the best they can to strengthen the response in that area, because that is driving the severe outcomes, I think, in Canada. So I think that is absolutely a key feature of this epidemic. We have seen that the day-over-day increase in number of cases has slowed down, but we will be doing more work on that front. being cautious about, where we're at. And so expect more, essentially, description of how that is going as we go along in the next coming week. I think, a lot of the trends are actually positive in terms of the slowing down of that growth rate. I think one area that people did sort of note is the case fatality ratio or rate. And unfortunately, given the outbreaks in long-term care facilities, we will expect to see more reported deaths as the days go on. And if people are looking at that ratio of deaths over the total number of cases reported, even as I said in my opening remarks, even as the numbers of cases, that growth in the number of cases slows down, the number of deaths, unfortunately, are expected to increase. So that ratio is a very dynamic one that we're monitoring. But for sure, the key observation is still that the severe outcomes are impacting those who are of the older age groups, particularly those over 70 in terms of hospitalizations and deaths. And that is the group where we really must protect in terms of, seeing a reduction in our impact.
Mia, follow-up?
Yeah, just sort of building on some of that long-term care concern that you mentioned, can you give us some updated statistics on how many of the deaths and cases that you talked about earlier today really are, we know were in long-term care facilities? And why did we not do more a month ago to set in place these kinds of guidelines when we saw outbreaks in long-term care homes immediately when this started to show up in Canada?
So in terms of the cases where we have the data on the whether someone was in the long-term care facility or seniors residence, we know that close to half of the deaths that we're tracking are linked to long-term care facilities. But that ratio is actually different in different provinces as well. So that's where we're tracking at the moment on that. I think that in terms of the long-term care facilities, all the provinces and territories have tried very hard. As you can sort of recall, some of the initial outbreaks started in British Columbia and then, of course, impacting all the larger provinces. And as all the health system, the public health officials are trying to strengthen their response, there was lessons learned and some of the key observations that were then built into these interim guidance. And I stress interim only because most of our guidance need to be updated on an ongoing basis. So this one, we will have to sort of look at that as we go along. But it's a sort of collective wisdom, if you like, from our experts that work in long-term care, infection control expertise, as well as what the provinces have had to work through and in the last weeks.
Thank you, Doctor. Operator, next question, please.
Thank you. Merci. The next question is from Lina Dib, La Presse Canadienne. Please go ahead. La ligne est ouverte.
Yes, hi. Maybe Dr. Tam, we could go on this line of thought. So did you compare the way British Columbia dealt with the long-term facilities with what Quebec is doing, and did you see any difference there that could explain why so many deaths in Quebec and less in British Columbia?
Well, I think almost all jurisdictions are essentially trying to deal with the outbreaks in long-term care facilities. So that's really across the board. But as people learn more, it's a very collaborative table amongst the chief medical officers. We all learn from each other in terms of what could be improved. And so, and some of the guidance will support them in doing so. And so I think policies that our Minister of Seniors has outlined with some of those key pieces. They're not always easy to roll out. We do have a very varied landscape in terms of long-term care facilities in both the private and public sector. And for sure, going forwards, the key lessons learned from this pandemic is that we really need to improve on infection prevention control and some of how we manage, to protect both the visitors, volunteers, healthcare providers, and staff. Some of what we learned, though, also incorporates the latest science. I think last week we talked about, the role of people who are only mildly symptomatic, health workers who may not know that they are developing symptoms as they go to work. All of those scientific observations were integrated into the latest guidance, which, for example, really emphasize the training in infection prevention control and monitor compliance and putting on and wearing masks for the duration of shifts or visits. That is not something that was previously systematically integrated into different jurisdictions' approaches, partly because that's the evolving science as we learn it as well. So I think we will all learn as a country and as a society, I think, about how we protect seniors and residences with underlying medical conditions, some of them very complex under those circumstances, and that we have to reduce the introduction of such outbreaks into those facilities. And that will absolutely have to be a priority as this epidemic evolves as well.
Lina, en suivi?
Oui, mon autre question, thank you, Dr. Tam. Mon autre question, c'est pour vous, Madame Bibeau. Quand vous avez annoncé que les travailleurs étrangers temporaires allaient continuer à venir, vous avez dit que ce serait aux producteurs agricoles de s'assurer de la quarantaine de 14 jours. C'était leur responsabilité au risque de perdre leur permis. Et maintenant, vous décidez de les aider financièrement. J'essaie de comprendre pourquoi est-ce que cette industrie, qui est comme une des dernières qui fonctionne encore dans notre économie, tant blessée, pourquoi est-ce que vous avez décidé que
Why did you decide that they too needed funding?
Alors, l'industrie alimentaire, incluant les producteurs, font face à des grands défis en ce moment, qui tournent pour la plupart autour des défis de ressources humaines, donc d'avoir suffisamment de travailleurs et dans les champs et dans les usines, mais ils doivent aussi mettre en place des protocoles de prévention pour protéger leurs travailleurs canadiens déjà. Ça a un impact sur la production, sur la capacité de transformation, donc un impact aussi sur ce qu'on achète de la part des producteurs. Et pour revenir directement aux travailleurs étrangers, au départ, on n'avait pas toutes les conditions du protocole d'isolement. On pensait que ce serait peut-être acceptable d'avoir un isolement qui soit actif. Donc, ils auraient pu travailler au champ tout en maintenant la distance. Mais ça s'avère que non, c'est pas suffisant. On leur demande de faire vraiment un isolement complet de 2 semaines. Alors, ça implique des coûts significativement plus élevés pour les producteurs, donc payer 2 semaines de salaire sans avoir de travail en retour, soit faire des aménagements importants dans leur résidence actuelle, et si c'est pas possible, de louer des chambres d'hôtel, par exemple. Alors, c'est des coûts importants pour les travailleurs, pour les employeurs.
Merci, Madame la Ministre. On va maintenant passer aux questions dans la salle.
Thank you, Madam Minister. We'll now go to questions in the room.
Okay. I've got questions about the new rapid test from Spartan Biomedical. These things have just been really approved by Health Canada, and I'm wondering about some details about like how long it will take till they're actually in use, who's going to get priority, and where are they going to go first?
Yeah, so this is the one component of our strategy to improve on lab testing in Canada, because they are more portable and they can be used nearer the patient, if you like, and they are quite rapid in terms of the turnaround time. The idea, I think, is to prioritize these to more remote areas that have less access to the more central laboratories, so that it would not require any transportation time for the specimens to be sent. So this, together with other more near-patient type testing, will be prioritized for communities that actually have difficulties, transporting the lab tests and to reduce turnaround time. So I think that is the strategy going forwards. So I think, the procurement side is constantly being updated in terms of how much we can actually get from this particular supplier. So I think that's a dynamic situation. And all I can say is we will get everything that this supplier will be able to provide in the coming months.
Do we have any actual numbers on how many we are going to get from the supplier, and how much difference do you expect that to make in the big picture of the whole testing plan?
Well, I think it will make a lot of difference to areas that have less access right now to the turnaround time. In terms of the supplies, this is dynamic, as we all know, depends on lots of different moving parts, but the procurement contract itself is trying to secure supply of the devices with 40,000 units per month in the upcoming months, and then see how that progresses in terms of the sort of supply rate. But every day we have to reevaluate the moving parts on this one, I think.
National News. Oh, is the mic on? Now it is. Okay, it's Addie Bergeron-Oliver with CTV National News. The latest data shows that about 73% of all cases are related to community transmission. So why can't every person who wants a test get one, including staff and residents in long-term care facilities?
So the community cases are, as I said, a lot of them are related to the long-term care facilities, and there are others. So they are the priority. They will always be part of the priority groups for the provinces and territories. That's the agreed upon laboratory testing strategy. And so all jurisdictions are looking at the testing for those kind of settings for sure.
And the government issued new recommendations on Saturday to long-term care facilities, but that did come weeks after the pandemic started. What tougher regulations is the government considering to prevent what is happening in Dorval from occurring elsewhere? And is the government considering any type of additional funding to help underpaid workers in these long-term care facilities? Because guidelines enough won't be enough if people don't feel comfortable going to work.
Mm-hmm. So you've brought up some very important points because we need to support workers who are going to work in those long-term care facilities. So these are in the jurisdiction of the provinces and territories. And again, you will see that it's not just these guidelines, but different jurisdictions are already putting in place different policies to strengthen the support for long-term care facilities, including how to restrict movement between the facilities but keep the workforce going. So you will see different strategies being implemented in different provinces, but all to shore up the actual human resource in those facilities. And also some jurisdictions have looked at the financial supports to even out the sort of rate of pay, if you like, between the private and the public sector. So you are seeing some of that, for example, in British Columbia. But I will leave it there. I don't know if our minister would like to say anything on that front.
Provinces stepping up, and we've got, BC did $10 million to enhance the infection protection measures and to improve the quality and safety of these facilities. Quebec has announced $133 million for added funding to private and public long-term care facilities. And Ontario just announced $243 million for surge capacity for screening, for infection control measures and supplies. So all of these initiatives are going to be helping the safety of these facilities, because having access to protective equipment, making sure that the workers can operate in a safe manner is essential. And I see provinces and territories seized with this matter and stepping up to do just that.
From the federal government, though.
One question, one follow-up. Dr. New, if you could just repeat Dr. Tam's initial response in French, please.
What was the question again? OK, en français. La deuxième question du support financier, je pense que c'est vraiment pour les provinces et territoires. Notre ministre a aussi constaté que les provinces comme la Colombie-Britannique, aussi le Québec, Ontario, ont donné aussi des fonds pour donner plus d'appui aux établissements de soins de longue durée. Pour nous autres, dans le domaine de santé publique, avec notre comité consultatif spécial, on a élaboré des lignes directrices. C'est vraiment en consultation avec tous nos homologues, les médecins hygiénistes en chef de toutes les provinces et territoires. Et c'est toujours quelque chose qui est en évolution, c'est toujours fluide parce que c'est toujours informé par l'évidence scientifique, les données probantes et aussi les expériences de toutes les provinces et territoires. Par exemple, maintenant, on sait que c'est un enjeu que les travailleurs qui sont dans un établissement, peut-être que travaillent dans plusieurs établissements de soins de longue durée. Donc, les provinces et territoires, au fur et à mesure, chacun a peut-être mis en place des mesures pour peut-être faciliter qu'une personne, un travailleur reste dans un même seul établissement de soins de longue durée. Une autre mesure aussi, on a mis en place dans plusieurs établissements selon nos lignes directrices, c'est que c'est important pour les visiteurs d'être comme restrictés, limités pour rentrer dans un établissement. C'est sûrement une question qui est vraiment considérée comme essentielle. C'est pour aider le résident et la résidente à manger ou des choses comme ça. Ça, c'est une chose. Aussi, on fait un dépistage pour tous les personnels, les visiteurs aussi, les travailleurs qui rentrent dans les établissements. Et maintenant aussi, on recommande aussi que les visiteurs et aussi les travailleurs portent un masque. Pour les travailleurs, c'est pendant tout leur shift dans l'établissement et pour les visiteurs, c'est pendant toute leur visite. Donc, on voit que c'est vraiment quelque chose, peut-être qu'il y a un mois, on n'a pas pensé, ou peut-être c'est pas si évident, mais maintenant avec l'expérience, l'évidence, on continue à élaborer des directives pour être toujours à jour avec l'évidence scientifique.
Always up to date based on scientific evidence.
Bonjour, Christian Noël de Radio-Canada. La question est pour la ministre
Christian
Bibeau.
Noël, Radio-Canada. The question is for Minister Bibeau.
Madame la ministre, avec votre réponse tout à l'heure concernant les tests, j'ai cru comprendre qu'il y a beaucoup de mesures qui sont en place pour s'assurer que la quarantaine est respectée, que les travailleurs étrangers temporaires sont en santé. Mais ce que je comprends, c'est qu'il n'y a pas de tests systématiques. Ma question, c'est pourquoi on ne peut pas faire de tests systématiques?
My question is why? Why not?
Je pense que c'est la règle générale aussi considérant la disponibilité des tests de ne pas faire passer le test à des personnes qui n'ont aucun symptôme. Alors, on surveille les symptômes chez les travailleurs avant qu'ils quittent le Mexique,
situation symptoms of workers before they leave, for example, Guatemala or their country of origin. We check to see if they have symptoms at the airport and every day during the isolation period. If they do develop symptoms, then we do testing, but it's not something that we do when people are symptom-free. So we do clearly monitor the situation and follow the recommendations from the Public Health Agency and the province of Canada.
Employeurs et aux agriculteurs. Les travailleurs migrants à qui on parle présentement nous disent que les règles ne sont déjà pas respectées. Ils vivent dans des cottages, certains vivent dans des petites salles où ils sont entassés. Il y en a d'autres qui ne sont pas payés durant la quarantaine. Il y en a d'autres qui ne reçoivent pas d'argent pour la nourriture, donc ils doivent sortir pour aller faire leur épicerie alors qu'ils sont en quarantaine. Est-ce que vous êtes au courant de ces problèmes-là? Et qu'est-ce que vous allez faire avec l'argent que vous donnez aux employeurs si ceux-là ne respectent pas les règles?
Alors, il faut faire la distinction entre les travailleurs étrangers qui sont ici déjà depuis plusieurs semaines, plusieurs mois, avant que le protocole d'isolement soit mis en place. Comme nous tous, on circulait sans prendre des mesures particulières. Donc, il faut faire la distinction entre ces gens-là et ceux qui arrivent depuis quelques jours, maintenant que le protocole est mis en place. C'est sûr que pour les nouveaux arrivants, le protocole, il n'y a aucun compromis à faire et les sanctions peuvent être extrêmement sévères, autant pour l'employeur qui ne les respecterait pas que pour le travailleur. C'est quelque chose qu'ils prennent très au sérieux, ne serait-ce que parce qu'ils ont à cœur la santé de leurs travailleurs, la santé de la communauté où ils vivent, parce qu'ils veulent avoir des travailleurs en forme dans 2 semaines pour faire tout le travail nécessaire. mais
2 weeks down the
aussi
road.
Financièrement, ça
But
peut
also,
coûter extrêmement
financially
cher et ça
speaking,
peut
it
même
can be
aller
very
jusqu'à des
costly.
peines de prison s'ils ne respectent pas le protocole.
And it can even include
Merci, Madame la
prison
Ministre. On va
sentences if they
retourner au
don't
téléphone
honor the
pour 3
protocol.
questions.
We'll now go to
Opérateur.
the phone for 3 questions.
Merci. Thank you. We have a question from Alex Ballingal from the Toronto Star. Please go ahead. Votre ligne est ouverte.
Just going back to the new guidelines, why is it that you aren't putting forward, the federal government, more resources to help long-term care facilities implement these guidelines? And are you able, as the federal government, to make these guidelines mandatory so they're not just guidelines, I guess, but they're actual rules?
So if I could please, the guidelines are there. They have been developed in cooperation and coordination with public health across the country, public health agencies across the country. It's I think rather than, as you know, it's a provincial jurisdiction. So what we prefer to do is to work cooperatively with our partners across the country, and we have been doing that. We have been doing that in terms of securing protective equipment and making sure that we have ample supplies in Canada, and we've been working diligently at that and putting over $2 billion towards that initiative, and those are important elements that are going to be needed in long-term care. We have been we've heard that guidelines would be helpful. I've heard that from some of my colleagues in the calls that I've had over the last few weeks, and so these guidelines are exceedingly helpful. I think that the initiative at this point is to work cooperatively across the country and not spend all our time fighting over jurisdiction. It's a Team Canada approach, as you have seen, in terms of procuring supplies, of working with Health Canada and with organizations across the country and businesses to come together to be able to supply the needs of our own country. And so we're working all together, and that is the direction we're going. It's a cooperative Team Canada approach, and so I want to say thank you to all of the companies, all the healthcare workers, and everybody that's working together. So rather than coming at this in an aggressive way, we're coming at this in a cooperative way, and this is the best way to move forward in Canada at this time.
Alex, follow up?
Yeah, just on the fatality rate that I guess this is a question for Dr. Tam. You mentioned that as we expect to see overall cases decline, the rate of fatality because of long-term cares will continue to go up. I'm wondering if that affects in any way the modeling that was released last week. And I know the fatality projection was based on a 1.1% fatality rate, I believe you guys said. Does the situation you described today change that at all, change our expected fatality rate going forward?
Yeah, that the what we call the case fatality rate changes over time for sure. It's very, very much a real-time estimation. And it's not until the end of the pandemic that you would actually get the true case fatality rate. But as I said, as the projections will change, and those the slide that you were referring to was actually the projection on cases, which keeps changing over time. So it's a very short-term forecast over the next week or so. And absolutely, those projections are updated based on the new reports on the deaths and on the cases. So I think the bottom line is yes, that those projections will be dynamic and change over time. But it is a phenomena that we would all see as the days and weeks come along, is that I expect the case fatality rate to increase as the denominator decelerates and the numerator, unfortunately, because of some of these outbreaks, the numbers of deaths will increase. But there's lots of other dynamics at play when you calculate that rate. So that for sure is going to change over time.
Thank you, Dr. Operator. Next question, please.
Thank you. Merci. The next question is from Guillaume Saint-Pierre, Journal de Montréal. Please go ahead. Votre ligne est ouverte.
Oui, bonjour. Je voulais revenir sur les tests rapides là, de Spartan. Madame Tam a dit tout à l'heure que ce sont les régions éloignées qui en bénéficieraient en premier ou en priorité. Qui d'autres seraient prioritaires sur cette question?
Merci pour la question. C'est Dr. New. Oui, comme on a dit, les tests comme les plus rapides de Spartan ou aussi peut-être des autres compagnies à l'avenir. C'est vraiment un autre outil, on dit, qui peut aider nos efforts ici au Canada. Parce que c'est un test, un dépistage. On explique que c'est comme au point au service et plus sur place au lieu de qu'est-ce qui se passe actuellement. Pour les communautés isolées au nord, il faut prendre, comme on dit, un échantillon avec un écouvillon des patients et puis il faut transporter l'écouvillon à un laboratoire plus au sud et ça prend du temps. Donc avec les dépistages, les kits comme ça, on peut avoir des résultats beaucoup plus rapides et c'est vraiment la priorité pour les communautés comme ça au nord isolées aussi, les communautés autochtones. Merci.
Donc, je comprends que... Est-ce que ça serait réaliste éventuellement de penser qu'on pourrait tester de façon rapide et plus systématique des gens qui gravitent autour, par exemple, des centres de soins de longue durée ou les gens où il y a un taux de mortalité assez élevé?
Oui, c'est toujours possible parce qu'on continue avec nos efforts de voir toute une gamme des moyens possibles. On continue avec le dépistage, le test qu'on utilise actuellement, c'est basé sur un test moléculaire. On continue toujours avec nos efforts d'élargir, d'augmenter la capacité laboratoire à travers le pays. Puis avec l'introduction des autres dépistages comme ça, c'est sûrement un autre moyen qu'on peut utiliser au fur et à mesure comme c'est approprié. Et aussi un autre rayon, quelque chose, on est en train aussi de travailler, c'est aussi, comment dire, le dépistage sérologique. C'est un test, un dépistage qui peut mesurer, comme on dit, la présence des anticorps. Et on a plusieurs utilités pour un dépistage comme ça. Et c'est quelque chose qu'on va élaborer et expliquer dans les journées suivantes. Mais c'est sûrement que si on parle de tous les tests de laboratoire, on travaille de tous les volets, les composants pour avoir la meilleure capacité à travers le pays. Merci.
Thank you, Dr. Operator. One last question on the phone, please.
Thank you. The next question is from Sharon Kirky from the National Post. Please go ahead. Votre ligne est ouverte.
Great, thank you. Dr. Tam, I have a question. On Friday, South Korea reported that 91 COVID-19 patients that were believed to have recovered from the disease tested positive for the virus again just before hospital discharge. And it's raising a question, can the infected get reinfected? And I'm wondering, have we seen any evidence of this in Canada, and what might be behind the reports coming out of South Korea?
I think there's many different hypotheses. First of all, I think is to verify the information. So getting our international partners to expand more on what is actually happening, and maybe, yes, having an international collaboration in terms of looking at what happens to someone who has initially been infected. We actually don't know if the test positive, I think it's a PCR test, means that there's any viable virus in that particular person. So that's one of the first questions that aren't actually answer. And of course, looking at the clinical course of the individuals over time. And I think it stresses the fact that we know very little about this virus in terms of the immunology, how the human body actually mount an immunity and what actually happens in the longer term. So those are all very pertinent research questions for sure.
And I have just one more question. There's a concern that the sort of one-size-fits-all social distancing, the shelter-in-place strategy, isn't feasible, especially over the long term when considering the economic impact that it overprotects the young and underprotects the old. And given, as you say, that the severe burden of disease is primarily among people 70 and older, isn't there a more reasonable strategy here? I mean, how do we protect seniors while easing the restrictions on people who are not nearly so vulnerable?
Extremely pertinent questions again. So one of the most important epidemiologic research question is the role of children, not just whether they are severely, whether they're mildly impacted or not in terms of severity, is the role that they play potentially in transmission. So it is something that the international community is working on because, of course, some of the measures, such as do schools resume, dependent on that experience. Of course, we do have countries that are a little bit ahead of us in their epidemic, so we will be trying to learn from some of those experiences of some of those measures being gradually turned off, as it were. For sure, I think prevention of disease impact to the at-risk population is still key. But I just want to emphasize that as we see this epidemic slowing down, we cannot let go of our public health measures in the near term until the whole of that epidemic wave comes to the bottom of that curve. We cannot relax those measures. But we are looking at, and some of the modeling is going to try and help us to look at those dynamic models as to which type of public health measures, as they go up and down, will impact the actual transmission or spread of the disease. So absolutely, we'll be looking at each of those components.
Thank you, Doctor. Bonus question.
Dr. Tam, Tom Parry with CBC News. Health Canada has now approved the Spartan test. The Premier of Alberta, Jason Kenney, has said, though, that he'd be willing to buy tests or treatment based on the approval of other countries. And I'm wondering what you think about that, about the Premier saying that. Does that suggest to you that Health Canada is being too slow to approve testing, treatments in a time of crisis?
I think we're exploring every single avenue, including tests that are approved by other countries. But Health Canada does have existing regulations pertaining to urgent public health need. So, for example, if certain treatments are approved in the United States or in European countries by their regulators that we know are of high standard, there are actual mechanisms to bring those solutions in safely. Of course, there are so many different tests now in so many countries. We do have significant concerns about the quality of some of those tests. So it is important to have that regulatory review. And certainly our lab, the National Microbiology Lab, does play a role in some of those testing of those kits to see, well, are they actually detecting cases? Do they actually detect antibodies? And so it's a bit of a team sport, but certainly numerous people have come in and suggested solutions, but we've got to make sure they're safe and effective.
Is Health Canada speeding things up then in this time of crisis? And is it possible that things could be sped up to an even greater degree?
Absolutely. I think the regulatory aspects of Health Canada are working at, breakneck speed and shortening review times. And I think as part of our pandemic response, the regulator actually tries to condense some of those specific periods of time for different aspects of, real-time incorporation of data for clinical trials, for example. So all of that are at play, but they must ensure effectiveness and safety for sure. But they are working as fast as every aspect of this response.
Thank you, Doctor. Ceci met fin à la conférence de presse pour aujourd'hui. Merci.
That concludes today's press conference. Thank you.